Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of an elderly patient who is also a client of mine who wears hearing aids, and they were reporting feedback, acoustic feedback, so whistling of their hearing aid. And more often than not, it's due to them either having a buildup of wax or dead skin. In the past, they've had dead skin such as this, which has then got infected, developed a fungal infection, Aspergillus niger, so a fungal infection under the umbrella otomycosis. And so as soon as they get feedback from the hearing aids, they do arrange an appointment just to have their ears cleared, because not only so they can hear better with their hearing aids, so the whistling stops, but also to prevent a fungal infection from developing. So quite often this skin is full of fungal spores. You see these white spores on there. But fortunately today, the dead skin wasn't infected. The reason why I made reference to the patient being elderly is because you quite often find that elderly patients are more prone to developing dry, dead skin in the ear. And that's just because as we age, our skin cells are less able to retain moisture, so the intracellular fluid, and therefore they dry up. And it's quite common with a lot of my elderly patients that they do have not only dry skin within their ears but other parts of the body. In addition, patients who are suffering from menopause or perimenopause, it's something, it's an anecdotal finding that I've come across, because I see so many women who are going through menopause or perimenopause. You have really, really dry, itchy ears, and their symptoms just developed in conjunction and coincided with the diagnosis of menopause or perimenopause. And of course, one of the symptoms of menopause is dry skin in other parts of the body, but I'm pretty sure there's a link there between the ears. Now, the reason why this patient's hearing aid whistles when they've got this buildup of wax or dead skin is a hearing aid amplifies sound into the ear, of course, and that sound, the amplified sound, it hits the wax or the dead skin in this case, and the dead skin and the wax acts as a protective barrier. The sound waves reflect off the wax or the dead skin out of the ear. So instead of allowing the sound entering, it reflects the sound away back out of the ear. And that amplified sound then re-enters the hearing aid microphone. So the hearing aid re-amplifies that already amplified sound that it amplified into the ear. And once more, that sound gets pumped back into the ear, and then again, the sound gets reflected back out of the ear, and it enters the microphone again of the hearing aid. And we get this vicious cycle, this loop, and we call it a feedback loop, and it causes the hearing aid to squeal. Another way you can kind of understand that is if you're at a party, and this often happens when someone's doing a bit of karaoke and they're singing too close to the speaker, and that's it's a feedback loop. So they're speaking into the speaker, to the microphone of and the mic's connected to the speaker, which is not too far away, and that amplified sound from the speaker re-enters the microphone, and we get that feedback loop. So I'm just peeling away this dead skin. I'm just using the fine end suction probe. The fine end's great with dead skin because it reduces the risk of clarinetting. When you sometimes suction dead skin, what can happen is the skin can violently flap at the tip of the sucker, and it can emit a very loud high frequency squeal. So with the fine end, it really mitigates that. I've removed the bulk of that dead skin. I'm just going back to the entrance now. The patient was developing the gag reflex. You've got a branch of the vagus nerve that runs at the base of the ear canal, and it's called the Arnold's nerve. And if you stimulate that nerve, so by applying pressure, patients can develop the gag reflex. They can really cough, and this patient really, really was. So just had to be a bit careful. It often happens when, as audiologists, we take ear impressions. So, like the dentist, they can take oral impressions to make retainers, for example, or braces. As audiologists, we quite often take impressions of the ear. So we use the same material, believe it or not, and it takes a cast and mould of the ear. And before we do that, we put a stopper in the ear. So it's like a piece of cotton wool. We position that deep in the ear so the impression material can't go too far and contact the eardrum. And as we insert the stopper, because it makes contact with the canal wall, quite often patients can elicit the gag reflex. They can also get teary eyes. With this particular case as well. The patient, normally my patients are sat upright and just in a normal position, but this patient preferred having their head tilted back a bit. So I actually, for the purpose of the video, rotated the video, but I was actually performing this like how ear surgery is performed. So patients are laid down horizontal, and the ear, you're seeing a different aspect of the ear. So the hammer bone of the ear was 90 degrees anti-clockwise. But it would have been made difficult viewing if I did it that way. So I simply pressed the rotate button on my app and it switched the video across. Well, I hope you enjoyed that video, guys. Do take care and speak soon. Bye.